Result of this conference. Some of you are already members, have been members for a long time. Some of you decided to join because you wanted to come to this conference. Some of you have joined us in the last couple of weeks as a result of some of our activities. So what are we? Well, we are a leadership organisation because we recognise that there has to be leadership within the independent sector. We're a representative body because we want to make sure that independents have a very strong voice within the sector. And we're also a support organisation. What does that mean? It doesn't mean that we're going to provide you with lots of services, but we recognise that you need to find a place where those services can be. And that's why we're also a support organisation. And we built up, originally established in 2006 as a support organisation for independents. Over the last couple of years, we've had a bit of a revamp and reorganisation. And from that, we started to focus on what the needs are of independents and what we can do for you. So last year, tail end of last year, we did a programme with Rebecca Benkiza, which was to look at the Which report that you might have heard about into pharmacy, that identified a number of concerns about the services that pharmacy was providing, with independents, unfortunately, in many cases coming off not quite so well. So what we wanted to do was work with partners to identify what we could learn from the Which report, from their findings, and start to help pharmacists and their teams to provide the best job possible. So we had a programme running across the country with Rebecca Benkiza. We've also started this year a programme of monthly webinars. Again, I know many of you have been part of those. And we started in January with a webinar in partnership with GPHC. Johnson & Johnson are our partners in providing the technology. They allow us to use their platform for the webcasts. And many of you will have heard Mark Vos, who's going to speak to us today from the GPHC. We had 1,000 people take part in that webinar. Nearly 800 online on the night, and a further 200 who were around the country in groups, some of them organised by their LPCs, to collectively watch the webinar. And that's one of the most successful webinars in the industry. And I know if Johnson & Johnson guys are here as well, they'll tell you that they were so bowled over by the numbers, they actually had to upgrade their technology to cope with it, because they've never seen those sorts of numbers. And that's because the demand for information about GPHC is so great. And we've opened those up right across the sector because it's the right thing to do, not just to independents. We also had a call to action webinar with Claire Howard, who's the Deputy Chief Pharmacist with NHS England. And from that, we produced, talking to independents and our membership, we produced a response to the call to action, which was submitted at the beginning of last week. If you want to have a look at it, you can do so via our website, www.theipf.co.uk. And then last week, again, many of you joined us, we had Sue Sharp, the Chief Executive of the PSNC, and her title was, "What the hell is going on in pharmacy?" And I'm sure a lot of you will want to know what is going on, and there is a huge amount. So again, she discussed a lot of the key issues. We've been involved with our other partners. We work with wholesalers, Sigma. I chaired their conference. Finn spoke at the Sigma conference in Cancun. We also work with others, including Maudsley's, for those of you who are customers with them. And partnership working is very much what we do. We recognise that we can't do everything. We can't do it all on the basis of a small membership fee. And as you know, we charge you just £120 a year plus that. And by the time we put on a conference, this is our first standalone conference, though we've worked in partnership with lots of other organisations, Pharmacy Show, activists who we are in partnership with today, Rebecca Benkiza, Johnson & Johnson. All of those organisations help us to deliver lots more in terms of value for our membership. So we've already been recognised. We won an award the tail end of February for our work with Rebecca Benkiza on the Which programme of training. And we've been asking you what the key issues are. one of the great things that we can do with the webinars that we're running with Johnson & Johnson is to ask questions online that people fill out as they're taking part in the webinar. So we asked you, what are the biggest dispensing related issues? And over 25% of you said it's non-availability of generics. And that's an issue which keeps coming back to us. It's supply and stock shortages. And we asked you how long it takes you each week for you or your team to dedicate to sourcing supplies. And over 2/3 of you told us it was between 2 and 5 hours per week. That's money and time you should be spending on something else. We asked you what you thought the main areas were that community pharmacy should be focusing on. Should it be living health and well-being aspects, taking on care of long-term convictions, or self-care and minor ailments? And you'll see that nearly 40% of you thought it was about self-care. But we're also going to show you what else you can do today to promote the support for long-term conditions, but also health and well-being. And we asked you how important you thought working in partnership was with other independents. And as you'll see, 2/3 of you thought you were either keen or very keen to work together. And that's what the IPF is about. It's about harnessing the power of independents to support each other and work with each other. And that is why partnership is not just about the IPF in partnership externally, but it's in partnership today. So one of the things I will come back to in a moment is how we can make sure that independents support each other. I'm going to hand over now to Graham Jones. Graham is one of the directors of the IPF. He's a pharmacist, runs a couple of pharmacies, but he's also chair of an LPN. And he's going to focus a little bit on some of those key issues that have been raised. Graham.
Thank you, Claire. Good morning, everybody. Good morning. I think it's very easy at an event like this to think in silos, think purely as community pharmacists and not actually look at a lot of the broader perspectives. And if you look at the government perspective, you've got to say why a challenge I was based came back to me from Andrew Lansley a number of years ago. It was when I was debating with him about GP dispensing and about some of the challenges facing pharmacy. The challenge came back to me is, why should pharmacists have a monopoly on dispensing? At the time, that was quite radical thinking, but I think as the years have gone by, I think we're all accepting that particular challenge much more. We do need to justify our existence. Is our distribution model, the model by which we get medicines to patients, very cheap, or is it very expensive? If we're not actually adding value along that process, about 20% of the cost of the NHS drug budget actually goes into the distribution. That is a very expensive model. We do need to be looking at how we can be delivering a lot more patient care along that particular route. Category M, talking about £800 plus out of each pharmacy per month. Government talking about £120 million they want to claw back from the pharmacy budget. Very big figures. But the reality is, the government don't expect us to make money on buying and selling of drugs, and these challenges will keep coming. We do need to look at how we can focus much more on patient care and delivering much better value for government and for patients. We have quite a number of challenges. Over the last decade, we've had the 100-hour pharmacy challenge, and that has clearly changed the vision of pharmacy significantly in a number of areas. But that 100-hour challenge will pale into insignificance compared to the sorts of challenges we'll be facing over the next decade or so. The rise of potential rise of internet pharmacy and an Amazon distribution model. And if we're not adding value to the dispensing process and to patients, that model will gain much greater traction. The challenge of GP vertical integration. GPs are increasingly getting much more involved in the commercial aspects of pharmacy. And I think that's a trend which will probably only continue. Fragmented commissioning. Pharmacy probably has one of the most complex commissioning models in the healthcare sector. We're getting commission from public health. Public health now moved into local government. Commission from CCGs. There's also the national commissioning process, which is again can be quite fragmented. If we look back over pharmacy for the last 2, 3, 4 decades, we've developed in many ways. We've developed in splendid isolation from the rest of the healthcare system. We now need to go through a process of reintegration with primary care, with social care, and with many other aspects to actually deliver on the potential that we've got. Integration with primary care need to work much more closely with GPs. I think probably a number of you heard the story that was running on the BBC this morning about the GP service being under, quote, threat of extinction. And one of the bits that really caught me and sort of got a loud expletive as I was driving along over here was the claim that from I think it was from Maureen Baker, who's the president of the Royal College of GPs, the claim that 90% of first contact patients have with the NHS is with GPs. That, we all know that's not correct. We know that pharmacists have a much greater role to play in that. But I think that's a matter of perception, a matter we need to get across to GPs if they actually believe that they are that first point, because pharmacy is in that front line of patient care, and we can be doing a lot more to deal with that. But we need to get it across to GPs, and we can be taking a lot of that burden, and certainly in minor ailments and other services, off their backs, so making life easier. But as well as integration with primary care, there's integration with community care. I've spent quite a bit of time working in local authorities, and there's a huge amount of potential work we could be doing, integrating our services, particularly looking at elderly care and mental health services. Great potential for pharmacy, and something we could be doing a lot more in. Integration with public health, now the domain of local authorities and health and wellbeing boards. But again, smoking cessation, weight management, the flu services is gaining a lot of traction, is something we can be contributing a lot more. But we need to understand how we get commission and how we can work much more closely with health and wellbeing boards and with public health in general. There's integration with secondary care, and certainly something that's come in my direction quite over the last few months since I've taken up the chair of a local professional network, is how we can much better integrate primary care pharmacy with secondary care pharmacy. And I think we've probably all been in that. We've all experienced the problems of patient admission, and hospital pharmacists spend about an hour on the average patient assessing their pharmaceutical needs. But then when they're discharged, the confusion that comes along when patients go back into community, when we'll get the phone call, can you do it? Put this patient into a medication into a NOMAD pack, but with no actual proper process for doing so. And I've had calls saying, can you do a NOMAD pack? And I'll put this MST into it. And no actual understanding that post-shipment, or even pre-post shipment, those sort of things just aren't acceptable in the community pharmacy setting. But there is a huge amount of work we could be doing there. But access, I think one of the crucial issues here will be access to summary care records, which is again something which is gaining a lot of traction in pharmacy. We can adopt a heads-up or a heads-down approach, and I, probably like everybody else in the room, have been very guilty at times of spending far too much time in the dispensary, doing a mechanical day job, and not enough time thinking ahead, planning the business, and spending that time actually delivering patient care. And I look back, as part of the call to action, I ran a number of events for the Thames Valley LPM, and one of the very interesting things that came back to me was the experience, pharmacists have not actually appreciated how much change had taken place. But when you actually look back over the last 10 years and look at the changes that have taken place in community pharmacy, the development of services like flu vaccinations, MURs, NMS, there actually has been a lot of change. And we need to appreciate what's going on. But that change is only going to accelerate, and I think if we're having this discussion in another 10 years' time, we will see a much, much greater change over the next decade. But we need to be ready for that, and we need to be planning, and we need to spend that time on patient care. Claire.
Thanks very much, Ray. Okay, so just then to give you a reminder of a couple of things. First of all, there's free Wi-Fi here. You should be able to get onto it under Finger, and there's no other code required. We've also got a Twitter hashtag, you'll see up there, hashtag IPF Spring, and we hope that those of you who are users of Twitter will do so. And obviously you can use today for CPD, but I also just want to remind you, when you signed in and you picked up your bag with all your various pieces of paper, you've seen a piece here, which was Independent Pharmacy Federation, one-page productivity planner. Now the idea is, by the end of this day, you will have filled this out, and this will be your action plan for what you're going to do differently starting from tomorrow. And what we want you to do is think about the projects that you are going to focus on in your pharmacy, because what we want to do today is about working on your business, not in your business. It's about getting your heads up and looking strategically at how you can improve the business that you have. So you're going to put your projects on there, and you're going to list the things that you need to do to help you deliver those projects. You're also going to write on there, who do you need to talk to? Who can you network with here? Who's got information that can help you? Who do you know that runs a service that you'd quite like to run? How can you talk to them about it? What sort of information do you need? What information do you need about GPHC inspections? What can you learn? And write it down in here. And what are your priorities going to be? Because if you're going to be involved with the IPF, not only do we want you to support each other, but we want you to actually show the leadership in your teams, with your pharmacy teams, that we want to be able to show to you within the leadership of the IPF. I'm now going to introduce Finn and Mark. You're both going to come up. Many of you will know Finn McCall is the chair of the IPF and founding member